Welcome back to MindMomBodyRN. I'm Rachel.
I'm Sophia.
And you can find us at MindMomBodyRN.com. Look us up. Today, we got to have our lovely coworker, Adam, on. Love Adam.
The most wonderful, soothing human being.
Yes. Like, I will even say, I have always said, Adam is like if Xanax were a human. But not like too much Xanax, like knocked out. Like
a healthily prescribed quantity.
Yeah, like
appropriate Xanax.
Yes.
Yeah.
Of the zen that it should provide. Not like, I'm not saying like he's the like picture of drug abuse. No, he's wonderful. But you would like Adam. You'd like Adam.
You will like Adam.
Watch, you will.
Shortly.
I have one really funny story. It's very, very short. Because Adam, the topic that we talk about is finding a therapist and finding a good fit and knowing what your needs are. Mm-hmm. And so this is a really short story. Eloise woke me up at 3 a.m. last week. It was really random. And she just patted me and shook me and said, "Mom, I pooped and I need milk." That's my story.
What more is there to say?
Yeah. So we'll let Adam say the rest. We are back with Mind Mom Body RN, and I am Rachel. My guest here today is my very best friend from grad school. Introduce yourself.
My name's Adam Retterath. I'm a marriage and family therapist.
And also a consultant for what amazing company?
MindMomBodyRN.
Yes, yes. And Adam is one of our postpartum consultants, so he works with a lot of our dads that need like education or different things going on. Adam can also do parenting coaching. Adam can do it all. He's amazing.
All of it?
So you can do... Adam cannot deliver your baby.
No.
Adam will not do that.
No, I shouldn't do that.
Adam doesn't want to do anything with your blood. But Adam will talk to you about anything. He's qualified to, talk to you about pretty much anything about your feelings.
Yes.
Yes. Or your trauma or, your adverse childhood experiences, anything, that might be affecting. Yep. Adam and I, as I said, went to grad school together. We both got our master's degrees in marriage and family therapy from St. Thomas together. We were in the same cohort. So one of the things, I've done kind of a big switch since then. I have since then become a midwife and gone to nursing school. But Adam has really stuck through. Everybody needs a therapist. I think that's a fair thing to say. You would agree? Yes?
Yeah. If everyone did have a therapist, then I think the world would probably end up being overall a more balanced place because then people would be talking about their feelings more and actually processing things and getting different perspectives on things. But instead of not. Yeah.
I'd also like to say, as a therapist, I also see a therapist. Do you see a therapist?
I had for a while, but I haven't for maybe a couple of years now. So,
which is also one of the great things about therapy because once you're in therapy, it doesn't mean that you're in it forever. I have taken so many pauses with my therapist where I'm in a season where I just am feeling good. I'm not feeling like I need that support.
Yeah.
And if you don't have a therapist that can see that for you, and you're feeling kind of like they're pushing you to be in therapy, and make sessions when you're trying to avoid it, that should be a conversation.
Yes. Because
there's definitely times for people where I think it's almost nice and healthy to take a break from therapy.
Yeah. Well, and if you feel like you need it, it's always good to think about why do you feel like you need it? Is it that it's feeling difficult to deal with your feelings or to talk about the stuff? Because it's sometimes that's fair and sometimes it's just if you're not used to feeling your hard feelings, then maybe you're trying to avoid it. Mm-hmm. And if it feels like the therapist is constantly trying to reel you in, but you feel like you're doing okay or you don't need it as much, then it's okay, well, they shouldn't be doing that. If you feel you're good to switch to every other week or just start spacing things out, then your therapist should also have a pretty good idea of that and agree with you.
Yeah.
Unless they can challenge you to keep going or something.
Yeah. So like an anecdotal example that I want to give of that is when I was pregnant with Wesley, I was dealing with just a lot of hyperemesis. Remember, I was really sick and vomiting a lot through that entire pregnancy. And I was in a place where I was like, this is too much. Yeah. I can't be also like managing my illness right now along with processing trauma.
Yeah.
At the time, I didn't really feel like he fully understood like what a toll it was taking on me. And then I think he did come to understand.
Yeah.
But there are times when like you have to just put that stuff on the shelf. Yeah. Like you've got to shelf it and like live in life right here, right now. And that's okay too.
Yeah.
Yeah.
And it's possible to kind of be over therapied, right? Like some folks like try to really bust through it and like, oh, I'm going to go 3 times a week or do it all the time, or I'm going to go to like 5 different therapies. And it's like, okay, well, you also get burnt out from it and not be able to keep up with it. And that's just differently taxing on your mind and body. So.
And when we say like work and therapy, I think like most people don't understand what that work means. It's not like work like, oh, I have a pile of these worksheets that I have to fill out. And once I fill them out, they're fixed. Like the work is like the ever evolving emotional investment that you make into like yourself, your thoughts, your consciousness.
Right.
You don't just do that like, oh, it's not like homework. It's not like writing papers. Like I did the work. Like the work is this moving, never, you know what I mean?
Yeah.
Yeah.
Just learning skills and increasing awareness and insight on things, but then also like doing the emotional labor of facing tough feelings that you've maybe been stuffing away, or like taking like proper healthy risks in relationships to like work through things that have damaged them and all that. So
yeah,
that's the kind of work.
Okay, so I do have questions for you. Yes. Oh, so my first question is, to start, could you share a bit about your experience as a therapist and why finding the right therapist is so important for someone's mental health?
I've been doing therapy now for about 7 years. The first year was the internship, and I was doing in-home therapy with kids, and that's a more intensive treatment style, I suppose, than outpatient therapy, which is what I've been doing now for just about 6 years. A lot of work with kids at first, also their families and parents. However, what was difficult with that was that I was new at it, and I'd say almost 50% of the parents just kind of used me as a babysitter and like didn't like to work with me on things. They'd just be like, here's my kid, make them do what I want them to, and I'm not going to participate. So it's like, that's not going to work, but I'll hang out with them. I'll be a stable presence in their life for an hour or so.
I feel like I did so much of that intern year. So much of it. And I was like, going to, I feel like we did a lot of babysitting, like our clinical rotations.
Yeah.
But at the same time, I think about like one little girl that I showed up for, and there were no parents there. And they, had to sign a whole thing so that like I could see her when her mom was at work and all this stuff. And I went over there one day. It was her birthday. Nobody remembered. And so like we walked to the gas station right there and like got her some birthday stuff and like yeah. And like, we were broke grad students, but like I still, it was a quick trip. I did it. And I think that a lot of like what we provided there was just like, she's going to remember that forever. Yeah. That like her family didn't remember her birthday, but somebody did. And that is going to like be a positive in her corner memory. And I think like you said, sometimes I'll just hang out with the kid and be stable, like watching a TV show with a kid that they're interested in and acting interested, like it's gold. It can be so much more than what we realize. Like, and I guess I'm saying this to circle around that so many things are therapeutic, and there's so many parts of being a therapist that people don't realize like we're consciously doing as a therapeutic exercise. Like, silence is a powerful tool. Like, it's not because your therapist can't think of anything to say, Sometimes.
But not all the time.
Yes. Can you talk about the importance of, if a therapist doesn't feel right, like what people can do? What is that conversation like?
Ideally, your therapist will be capable of receiving that kind of information. Not everyone is, and they take it personally, but if you feel like there's a mismatch or there's just, I don't know, they're not quite hearing you or understanding you, like, one, there can be a conversation about that and just working on trying to like figure out where there's not a connection being made, but also you don't have to feel like there's a need to have a conversation. Like, you can always just call in or cancel appointments, stop going, whatever. If there's a mismatch in personality or not a good fit for any reason, it's like, just go with your gut on that and find a new therapist, because there's quite a few. Sometimes who's available to you is different, but now with telehealth being a lot more accessible and generally covered by insurance, as long as somebody is licensed in the state you live in, then just find somebody new, because there's all kinds of personalities out there, and it's like you need someone that works, because if not, then you're that much less likely to open up or tell the truth, or like,
Right. The same way, if you had a bad experience with a doctor, you would go back to a different doctor. Right. Like, and we're used to it. Like, we really are used to being like, because like I am a totally different therapist and practice totally different than Adam does. That doesn't mean like one of us is a better therapist than the other. No, I'm just kidding. But, no, Adam is. But we practice very differently. Like, I have this big energy where I'm like very much like engaging, and and Adam is, I've said it before, if like Xanax was a person, it's Adam. Like, he has this very calming, grounding, masculine, calming, powerful, protective feeling energy. No, I'm serious. Sure. Yeah. And it's very different, and different clients need different things. So, I mean, that's okay. It's totally okay. And just because one therapist, let's say you like moved and you find a new therapist and you're like, that's not the way my old therapist did things. It doesn't mean that anybody did something wrong or practiced whatever. Maybe you've grown and this therapist is trying a new thing with you. Yeah. But there's no exact right way to like be a therapist. There's a lot of wrong ways to be a therapist, but there's no exact right way. There's a lot of right ways.
Yeah. And I think another important thing with it too is like, if you want to find a new therapist, like it can be worth it to talk to a current therapist about it, because if you let them know like what's not working or what you'd prefer either in the therapist or in the treatment or anything like that, they might be able to like get you a referral to someone who they think would be a good match and that they trust. So then, assuming you also trust that therapist, even though it's not a good match, then you can go with who they might refer you to.
And the other thing too is being upfront about like, I'm struggling with a lot of trauma. And maybe like that therapist is not as trauma informed as someone else could be. And they're like, I am great with working on gender issues or, youth, but I'm not the greatest with trauma. Like, find the person that's special, is more specialized and is knowledgeable in the area in which you need support.
Right.
Yeah.
Yes.
So what does it feel like when you found a therapist that is a good fit? Because I think I just want to add, it's important because therapy doesn't always feel good. Just because a therapist challenges you and makes you question things doesn't mean it's a bad fit.
Right.
Say more.
I mean, for some people, it's going to feel different because it's like, if you're an anxiety-driven person, it's going to feel more like you can kind of let go of the anxiety. If you're more of like a gut person, it's just going to be like that feeling of knowing. But usually signs of having a good match are things like you don't feel like you need to withhold information. Like, certainly if there's like deeper things that you just don't want to talk about right away, that's one thing. But if you feel like you're skewing what you're saying to like avoid telling the truth, then it's like, what's making you feel uncomfortable, unsafe about being in the room with that therapist?
Yeah, or that like, what are you worried about that their opinion about you would change? Like,
right.
Yeah.
And some of that can still be there, and it's like, usually it might take 2, maybe 3 sessions before you get a proper feel for if it's a good match or not, just because, initial intake session is usually going to feel unhelpful or not very focused on what you're trying to do, because filling out weird paperwork
but it's
and
super
stuff.
important.
Well,
Yeah.
But then, I think for knowing that good fit, right, it's a good feeling, or you feel connected, safe, relaxed. You're able to just kind of talk about your stuff, and also just like feeling heard, I think, is one of the bigger things. Yeah.
If you're feeling seen and heard.
Yep.
Because like therapy is like your time. It's almost, I almost compare it to the parenting relationship, almost in a way that like it is not your job to hold space for your therapist. You don't owe your therapist. It's not the same as having a friendship where, you know, you take turns holding space. The same with having a child. Like, it is never my child's job to hold space for my feelings.
Yeah.
If you didn't have great parenting growing up and you didn't have healthy boundaries, therapy is one of those places, yes, you're paying for it, but as an adult where you should get that positive, like unconditional positive regard. Mm-hmm. Like, that is what you should get from your therapist. And that can sometimes fill that void. And having that space, even if it's an hour a week that's meant for you, mm-hmm. to have somebody hold space, unconditional positive regard and all of those things, it truly makes you a better parent at home to be able to do those things for your children.
Yeah.
Because somebody is doing it for you. Like, you're getting yourself taken care of, you know?
Right.
Yeah.
Yeah. Well, and like, to kind of piggyback on that, that's a pretty big red flag too, for if you're seeing a therapist and they're spending a lot of time talking about themselves or their own issues, because it's like, there's no reason for that. Like, certainly there's some level of self-disclosure or telling a story to like communicate things. Like, it's not just you that feels that, or here's an example of how it's played out in my life, and just like making things feel more universal, or mm-hmm. helping the person feel heard and understood. But again, it's like, it's specifically chosen stories and times and reasons for telling it. Mm-hmm. But, you know, I guess this isn't a client or patient known thing, but if the therapist is telling them something because it feels good for the therapist or because they want to, but there's no benefit to the client, then it's like, that's when it's problematic.
It's a problem.
Right?
Yeah. And it's if you're feeling like you're holding space for your therapist, it's not a good fit.
Yeah.
It's really not. Because you're just shorting yourself. You're shorting yourself. I did want to ask about, so therapists, we kind of touched on it, but therapist specialization. What factors should individuals consider when looking for a therapist with a specific specialization, such as marriage and family therapy or trauma therapy, or like you're trained in EMDR? EMDR, yes.
Yeah, I mean, when you call a clinic, especially if it's a big one, they'll usually have ways to like sort through those sorts of things and what providers have which specializations. Mm-hmm. Otherwise, checking clinic websites or psychologytoday.com, you can filter by specializations and things like that. And also, like, you can filter by gender, maybe age, and all sorts of things to like mm-hmm. try and find who you think you're going to connect with best.
Right. Yeah. There's all these like, like maybe if you're looking for someone for your kid, you can do people who only see kids, or all the things, just like a doctor.
Right. And so it's like, at some level, finding that's important, especially if you have something very specific you want to work on. Like, if you want to work on trauma, it's good to have a trauma-informed therapist or somebody who's trained in prolonged exposure or EMDR. Mm-hmm. If you're wanting to work on something a little bit more general, like anxiety or depression or anything like that, usually you can end up with any therapist without they don't need a specialization in anxiety. You can pick that. Mm-hmm. However, most therapists are used to seeing, even if they have a specialization, still a pretty general population sort of.
And we're trained to see the general population. I mean, the same way like physicians are pretty much trained to see like big things in big areas. Like, it's the same thing for us. We're trained to work with everybody. We have some training, but then some of us choose like our niche patients that we really like are into.
Right.
The other thing that I wanted to say is if you don't specifically feel like you have something you want to work on, like you don't have to go to therapy with an agenda. I mean, maybe the thing is like you want to learn more about yourself. Maybe you want to be a better parent, but maybe also you just have heard that therapy can be really beneficial and you want to see what it's like.
Yeah.
You can, there's no like bad reason to go to therapy. There's never a bad reason.
Right. Yeah. And, you know, sometimes people come in and they have initial goals, and then sometimes an issue in life resolves itself after going to therapy twice, but then they keep coming, and then they're just like, I don't know why I keep coming. And then it's like, well, I don't know, because you're able to just talk about things freely here with no judgment and validation and ideas on how to think about things or do things differently. And so it's like, whether you show up with a specific goal in mind or not, whenever you come to session, if you don't know what to talk about, your therapist should hopefully have an idea based off of your treatment plan on like what things you're generally trying to do so that they can direct things. But then some days it's like, it's also fine to just show up and be like, I don't know, I'm kind of fine. And it's like, okay, well, what do you want to talk about then? And you just kind of talk about random stuff.
And sometimes it does come around to really like when you just talk and you have this like unconditional positive regard as like a sounding board, which is therapy, this space that is only for you, about you. It would be weird almost to be like, so tell me how your kids are. No, like we're talking about the client's kids. It's their space. Even if you feel like we just talked about casual things, you're not going to feel like you made a major breakthrough each session.
No.
It's like going to the gym. It's a habit. Like you can't just go one time and be like, I'm going to have big muscles. Like you learn lots of things through consistency over intensity, you know? Right. What methods or criteria can individuals use to assess whether a therapist aligns with their needs and goals?
Usually a therapist should make space during the first session for clients to ask questions about the therapist or anything else. And therapists should usually go over like how they go about therapy. So that's part of it. But, again, don't be afraid to ask the therapist about like what they generally do to treat certain things, like especially if you're like, I'm here for some depression treatment, like how do you normally treat that? Like you can do that and ask that and go based off of their answer. And some of it too is just like spending enough time with the therapist. Again, sometimes it takes 3, maybe 5 or 6 sessions before you're like, I don't know if they quite get me. But then it's like, again, you can either go with that feeling and find someone else, or you can like tell the therapist. Like it's okay to tell your therapist, hey, it seems like when I say things, you don't always, or most of the time, don't understand what I'm trying to tell you. And then that's a chance for the therapist to like kind of check in with themselves and be like, okay, I'm missing something. And hopefully instead of being offended or taken aback, they're just like, oh, I'm really sorry about that. And then they like try to work on understanding you.
Yeah.
And it's like, if you have a therapist that genuinely cares and is actually curious about you, you shouldn't have a problem. But if they seem like they either use a cookie cutter treatment method for every single person, or they don't actually care, like if they seem like I only do this because money, then it's like, okay, I mean, sure, being paid is part of working, but also you want to have a therapist that actually like cares about you as a human being.
We truly care about our clients. Like even though like we grow a relationship with you, and it's all, I don't want to say it's like a child, but I kind of almost look at it like my child, where even though I'm getting something in return, which is money, it is me holding space the same way that I would. The other thing I wanted to say about that too is when we were, I don't know if you remember this, but we took Dr. Peltier's class, and one of the exercises that he had us do is we had to figure out what our own hard lines were as therapists. For myself, I have a really hard time, I found out, and can't work with clients who are trying to not use domestic or like use corporal punishment in the home. Sure. I have zero tolerance for it. I'm really triggered by it. I can't work with that. Like for that point. I also have had therapists who, like, I used to work in a women's clinic, and I, as a healthcare provider, carry some healthcare trauma.
Yeah.
And I've had therapists that can't, it's so misaligned with what their value system is. Like, they were just upfront, like, I can't hear about your work in an abortion. They're like, this isn't going to be a good fit. It's not going to work. And as therapists, it's our job to, like, tell you if, like, this is not something that I can support you the way that you deserve to be supported.
Right.
Your therapist should have enough, like, actualization to be able to say that too, because not every therapist is going to be able to handle every subject matter. We all have our own hard lines of clients we can't see.
Right.
So thank you for being here. I do want to tell one funny story about Adam. When we were hanging out, you'll know it, just recently. Okay. And I was like, Adam, will you be on my podcast? And you were like, sure. And I was like, awesome. What should we talk about? And assuming, because we have both gone to school to be therapists, we have maintained our friendship. We talk a lot about therapy topics. So I say, well, what do you want to talk about? Assuming that he would understand I wanted him to talk about therapy. And he goes, well, I don't know. I know a lot about Star Wars.
Yeah, I mean, I could rant about that for a while. Star Wars, I could tell you about bugs. Yeah. I could tell you about plants.
I can tell from your
story. I don't want to go on your lame podcast about nerdocene.
Yeah.
Rachel.
Do you want to do Dungeons and Dragons? Like, we could start a Dungeons and Dragons podcast. So we're going to change this to Mind Mom D&D.
We'll make it Critical Mom. They won't get the joke, but...
Yeah. Yeah. Okay.
Okay. So this
Critical
is Critical
Mom.
Well, Adam, thank you for being here.
Of course.
And thank you for being available as a consultant to all these people who now have gotten to see how warm and fuzzy you are so they can book appointments with you. Thanks for being here. Love him.
Yeah.
For Adam, right? Yes. Big claps for Adam.
Always.
Always. And I have one question burning a hole for us in our mailbag. Here we go.
I love answering these.
Question from Emily in California. I am a single mom raising my daughter, and I want to instill confidence and resilience in her. What are some practical ways to do this, especially when faced with societal pressures?
That's a big question.
It's such a big question, and it's like, I hate that it is like this, but I still feel that socioeconomic status plays a big role in like the different ways as a parent that you can approach this. And I hate that. I hate that because we all want to give our kids everything that we can give them to help them feel confident. But at the same time, a lot of us don't have the ability to give them everything that they want to make them,
Okay, I'm going to tell you what I was thinking, and we can decide together if it would work at 13.
Okay.
And so mostly what I'm thinking here is scripting mantras. Mm-hmm. Like helping her write a good inner dialogue for herself. Mm-hmm. So like encouraging her in the morning, before she goes to school, you're doing hair and you all say, I'm confident, and have her repeat it. Say, I am brave. Mm-hmm. I am clever, or whatever you want to pick as a basis. And knowing your kid, like knowing what she is, and what she's working on. Saying those things together, I think that can have a big impact.
Yes. To self-disclose a little bit, I was the kid that like never had anything on brand. And I had like a lot of really rich friends, thank God, because like the parents like exposed me to a lot of really cool things. But I was never the kid that had like the name brand stuff, like didn't know how to do any of that, was always like super jealous, right? Like I'd get a Hollister sweatshirt. Remember that was like the big thing. I'd wear that shit just to thread. Yeah. And what I have found with that I am loving about this new generation is that it's not so much for these kids about name brand. Like when we were younger, it was like, we're going to go to Limited 2 or we're going to go to Hollister or whatever it was, Aeropostale, it's not so much like now. It is very affordable, and it's a great thing for you to take some time and go thrift with your kid. Seriously, thrifting is so much fun. I did it all through college. You doesn't have to like take a lot of money. Even if you can come up with like $20 and be like, hey, this is my treat. I love you so much and I want you to feel good about yourself. And we are going to go find some pieces that make you feel confident. Kind of like going back to Sydney.
Let's treasure hunt.
Let's treasure hunt. It's fun. It'll be fun to do together. And that also, if you're not used to giving your daughter compliments, it kind of sets the stage as a really great way of doing that and not making about her body. I love how your eyes light up when you try that on. I love how you can tell, girl, I can tell you like those pants on there. They fit you well. You look good. You look
the colors you pick are so good.
You walk a little taller in those. I like that.
How'd you find that? You have such a good eye.
Yeah. Right. And also having fun because like I never had a mom where I got to share her sense of fashion. Whereas like Eloise and I now are constantly like, do these earrings go with this? Whatever. Like make it a fun thing. Connect with your daughter on that level if that's something she can connect with you on, or even maybe you're not one of those types of moms, which is fine. But as a mom, this is something she's worried about and something she's interested in. So even if it's not your thing, show enough interest.
Find a way to connect to it.
Yeah. If she's interested in makeup, even if you're a mom that doesn't do makeup, like, come on. Let her, you know what I mean? Like, just be in the space with her. Remember what it's like to be a teenager. Remember that, like...
And even if that's letting her teach you.
Yeah. How fun would it be to be like, okay, I'm curious how makeup would go. Let's go to the drugstore. Because you can get a lot of makeup products for $8. You know what I mean? You get the $1, like, dollar store general makeup. Take turns applying makeup on each other at night. Practicing.
It's fun.
Having fun. She doesn't have to wear it to school.
Take it off after you're done.
And then in your spare time, literally watch some YouTube videos so she doesn't come out looking like a clown, Don't do her like that. But, And that's my advice.
For sure. I think that's great advice. We would love to give you more.
Yeah, we'd love to give you more. All right.
I'm Sophia.
Oh, and I'm Rachel. And until next time, take care, Mama.